Okay, our next speaker is Ron Baynes from North Carolina State University, and he's going to talk about chemical residues in dairy cattle following use of organic therapies for mastitis.
Thank you very much. Microphone here.
Yeah.
Okay, thank you very much. This is a follow-up for some of you on yesterday's discussion on complementary medicine, and I'm sure many of you have had some questions about the efficacy of these products that are on the market for some years now. But I'm not going to talk or debate about that. What I'm going to focus on today are the pharmacokinetics and especially the residue depletion of these products that are out there. My interest, I got into this as a side note with others, because primarily my job is working with the Food Animal Residue Avoidance Data Bank. Some of you over here in the EU are probably familiar with GFARAD. And our job, of course, is to look at extra-label drug use and provide recommendations to veterinarians, primarily and producers for extra-label drug use, cases that we get periodically. Okay, so the snapshot, this is a quick snapshot of the study that we conducted over the last 2 years at North Carolina State University. And the question we had was, can these humoral mastitis products result in volatile residues? Well, these are known as generally regarded as safe substances, and basically they're seasonings for most of them. Thymol, carvacol, often are products that are relatively safe. But our concern is, as a scientist, as a veterinarian, we all are concerned about, are we creating violative residues? Any substance in there can be seen as adulteration in meat or milk products. So we were looking at several substances here. One of them I'll get into, Phytomass, which contains carvacol and thymol. And the other product, Autosol, contains primarily carvacol. And the carvacol product was administered to the udder, the surface of the udder, whereas the Phytomass containing these two ingredients were administered intramammary. And I'll give you some background into some of these phytoceuticals, if you like. A few rules that Hugh Carriman covered yesterday, but I'll just go through them pretty quickly here for you to remind ourselves of the rules on the use of organics and the organic industry as regulated in the United States. Total sales over the last couple of years of organic fluid milk has increased, has doubled a lot, and just recently in the last year, 2015, is represented 5.1% of total fluid milk. Okay, so this data was just recently presented. What are the rules governing the use of these substances? What are the rules for keeping animals in their organic status? Well, here they are. As Hugh said yesterday, these organic dairy farms are not permitted to use antibiotics to treat cattle, okay, once you claim they're organic cows. If prohibited products are used, then treated animals permanently forfeit their organic status, okay? And then the most important one, of course, here as veterinarians, you're aware of this, organic farmers must not withhold treatment to preserve the organic status, and that's an important rule. Some other rules as well. Administration of medication in the absence of illness is prohibited, except for biologics. Provisions for use of products, of course, is sort of managed or looked at by the United States Organic Dairy, by the National Organic Standards Board. And most of the ingredients are, as I said earlier, are grass, generally recognized as safe, listed for human consumption. The National Organic Boards, the NOSB, cannot approve the use of intramammary products labeled for mastitis treatment. When you start using the word treatment, it infers that you're looking at a label-approved drug by US FDA. So therefore, these products are not drugs, okay? They're just simply products. Therefore, most importantly, their presence in meat or milk must be deemed a residue violation if detected by the United States Food Safety Inspection Service. I'm not going to go through all of these, but there are some allowed, some drugs, synthetic substances that can be used on organic livestock production systems. Highlighted a few of those, and why I highlighted them in red was to indicate to you that there's some very long extended withdrawal times for some of these, okay? 42 days meat for butorphanol, I'll skip over to xylazine, for example. We do get a lot of calls for xylazine and tolazine and Farad. And you can see we have 8-day meat withdrawal times and 4-day withdrawal times. AMDUCA, for those of you not familiar with the term, AMDUCA stands for the Animal Medicinal Drug Use and Clarification Act, only in the United States, which allows within specific guidelines for extra-label drug use. And therefore, Farad is the source of information for extra-label drug use and obtaining information on withdrawal times for such cases. Here's a product we're going to talk about very shortly. And this product here is Phytomass. As you can see on the label there, 2 tubes at first application, 2 tubes 12 hours later. There's an expiration date on there. There's a milk withhold. You can see barely make it out there, 12 hours. I'm going to get to that shortly. A meat withhold of 1 day. This product specifically would list the ingredients. You can see the botanical ingredients, of course. And there are some claims. There are some claims for bioactivity, anti-inflammatory, immunomodulatory, analgesic, and antibacterial. Thymol oil in this contains thymol and carbachol, as indicated earlier. And these are the chemicals there. I won't go into the details. Well, for most of them, it's fairly well characterized. So enough of that. Another product we'll talk about, Uddersol, is applied to the udder surface topically. I find this one very interesting because the directions for use does say apply 20 to 30 mils to affected area, rub in briskly, but no residues, no withdrawal time required. Get to that later. There's some putative efficacy. I won't go into that debate. This was discussed extensively to some extent yesterday as to the quality of the data that we have on efficacy. But however, only very few in vivo studies in literature, and most of the efficacy data we have up there is equivocal. So the question is, we need to look at the residues. Are there any residues in the meat and the milk? So we were among the first to do a PK study because they'll be concerned, as I said, by the regulatory authorities for the presence of these substances in meat or milk. So here's our methods here. We got some dairy cows. These organic dairy cows were recruited from various states, North Carolina included, Virginia, West Virginia. We brought them into our research unit, and we acclimatized them. And we evaluated 3 products initially. The first product we started out using, we found there was little to no residues, so we discontinued that. So I won't have any data to show you for that first product, which is Dr. Paul's CEG tincture. The other 2 products we'll get into in some detail. We dosed at 1x, which is the recommended dose or recommended use indication on their bottle. And so 1x and then 2x were used for both products. The samples were collected, blood and milk, and of course animals were slaughtered at different time intervals, as you do normally for submission of some of these, for drugs, as that is, to regulatory authorities. We did a SPME, solid phase microextraction, coupled with GC-MS-MS. These were semi-volatiles, so it was pretty easy to come up with an assay for these substances. And our target substances were carbachol and thymol. As I said, liver, kidney, and fat samples were obtained from animal sacrifice at targeted time intervals, as we did in a regular tissue residue study. This is a little schematic of the SPME system hooked up to a GC-MS-MS. We had some nice LODs, LOQs, precision and accuracy, so we went through all that painful work in the laboratory to make sure we know what we're getting. And here's the results. This is the plasma concentration time profiles for thymol and carbachol at 2x dose. And they sort of mirror each other, if you like. And you can see within, as Hugh said yesterday, with the studies we did with goats 5 or 6 years ago, by 8 hours, nothing was found in the plasma. That's pretty good for both substances at 2x, okay? Labeled dose, recommended dose, sorry, not label. Looking at milk now, you'll see that by 24 hours, we were pretty clear of both substances. Keep in mind, there are other substances in there. We're only looking at 2, okay? 2 target molecules, but there are other substances in there. We look at Uddersol, you'll see that if you compare those 2 graphs, looking at the y-axis for both the plasma and the milk, you'll see, looking at it very carefully, look at what I've done there, you'll see that most of the drug is concentrating into the milk compared to the plasma. Let's look at the PK data, the parameters, PK parameters we were able to obtain. What I circled there on your right, which is the AUC last, so the area under the curve. When you compare for carbachol in milk and carbachol in plasma, you can see that concentrating effect. And you could just, I also highlighted some of the Tmax values, and the half-lives are pretty short for the most of them. Of course, the longer half-life for the topical is because of the flip-flop kinetics that you're seeing with topical application of Arterisol. So that's why the Carbachol has a longer half-life. And a kind of busy slide here showing you that by about 72 hours, most of these two substances are cleared from these target tissues. So by 72 hours, they're below the limit of detection for the most part. So basic summary of the findings. The first product I said, we didn't see anything at all in the meat and milk, so we didn't pursue any further studies on that. For the plasma, as I said, we're going to see some traces of carbachol and thymol all the way up to 12 hours and 8 hours for intramammary. The milk concentrations of these target molecules are below LOQ within 24 to 36 hours. We went extra, use the word label, but I don't want to use that word, but extra recommended, just to test and see, because some farmers like to go beyond what's recommended. And tissue concentrations, again, were below detection limits at 72 hours. Clearly, based on the previous slides I showed you, a 0 milk or meat withdrawal time does not apply for these substances if folks within the regulatory authorities are looking for these substances, okay? Future work will obviously evaluate the meat or milk withdrawal time using the tolerance limit method that's used both in the EU and the US FDA. And so we'll be looking at that as we assimilate our data. Also, future work, we're looking at the influence of mastitis. That's going on as we speak this week in North Carolina, looking at the effects of mastitis on the clearance of these two chemicals. And many of you have seen a lot of our work on the effects of mastitis and disease on the clearance of flumixin, for that matter. What proportion of concentrations of these substances are in these products? Okay, what proportion of actives are there? Actives meaning so-called actives, carbachol and thymol. Is there any variability? Are there differences across lots? And is there any persistence, again, of these actives and other actives in the meat and the milk? Is there specific partitioning into the cream and the milk? And we can get off flavoring and effects on processing and so on of milk products. Effects on mammary epithelial cells, that's debatable. What is the effect on these epithelial cells? And do these substances interfere with screening, Delvo, charm test, and so on? Okay. I'd like to acknowledge USDA, NIFA, for funding a lot of this work. We have a strong chemistry team, pretty international team, in fact. And the PIs all mentioned there, Dr. Kevin Anderson, who I believe is in the audience here, Dr. Keena Mullen, and our PI, Dr. Steve Washburn. Okay,
thank you very much. We've time for just a couple of questions. So maybe I could just start with one.
Sure.
So you measured the thymol and the carbachol, but not the individual components, isn't that it?
Exactly.
So this is something you'd like to do?
This is something we're working on. Chlorhiza, methylsalicylate are our targets right now. Other substances that are out there, we're focusing on those other two. But we know that that's going to be a tall order.
Yeah.
But we're focusing on the major actives, and thymol and carbachol appear to be the major actives so far.
Okay, and for those of us who weren't there yesterday,
yes,
could you just maybe review whether these things actually work?
Good question. As I put me on the spot right there. The efficacy is equivocal. So far, there's a big debate as to whether these substances, we know in vitro, we've seen a lot of evidence in vitro that these substances could be effective against most of our microbes that we normally associate with clinical mastitis, subclinical mastitis. But it's still out there. The jury is still out. We do not have sufficient data. I believe Virginia Faith was talking about this. There's a lot of bias out there, and that needs to be creamed out and screened out, and we need more work. And good GLP studies will help us get there further and faster. And standardization, which is standardization in the product production, which is now occurring, I must say, that's going to reduce the variability between lots and so on, and just have more confidence in it. Again, this is what may happen in the end, as said by the chairman yesterday of the session, is that this truly could become complementary medicine. It's not end all and be all. And we do believe there is some effect on the immune system, And so that way we can see that this may be helping along the way, but it's not going to be the end all and be all. We cannot kill all the bugs with all the antibiotics and so on out there, but this could be seen. But there are a lot of skeptics, including myself and many other veterinarians out there, as to how these work. But we're seeing more than just the occasional efficacy. We're seeing more than this. There's a growing evidence that these could once we get some solid, better evidence.
Okay. Thank you very much.
Thank you.
Okay.